Welcome to Human Experience, Inspiring Workplaces podcast by HR.com, your trusted source for creating thriving work environments. In each episode, we explore the keys to building workplaces where employees feel valued, engaged, and inspired. From goal alignment and performance management to health, well-being, and meaningful recognition, we cover all the essentials for fostering a positive workplace culture. Let's dive into what makes workplaces truly inspiring.
Hello, everybody. This is Debbie McGrath, the CEO of HR.com. And today's guest in Innovation in HR is Brent, and he's here to talk about this really cool new solution in the benefits space. So can you introduce yourself and tell us a bit about the company that you represent and why this is such a new, cool feature for our benefits?
Sure. Thank you, Debbie. My name is Brent Weiss. I'm a co-founder of Beyond Med. Beyond Med's a health and wellness plan that's focused on elective and cosmetic treatments. So treatments that are typically excluded or limited from the typical insurance plan. There's 16 different specialties on the plan, and a lot of them are considered elective or cosmetic. Happy to get into the specialties, or if you want me to, I can wait and then do the specialties after.
Great. So why did this come up as an idea for you? Obviously, I've been in the HR space for 25 years, seen a lot of benefits suppliers, and innovation isn't really new or coming into the benefit space as much as I've seen in the last year. I've seen children benefits, cancer benefits, and now this, which I thought was really, really unique. So what prompted you to decide to come into this space?
Yeah, so I've actually always pretty much been involved with benefits, or I should say my family company growing up was dental insurance. So growing up, I was around the industry, basically doing all sorts of tasks for the dental insurance company. I actually went off and was in finance after I graduated from school, but in private equity, still focused on insurance companies. And me and the other co-founder actually started tracking two different metrics. The first metric was employer frustration with what's currently being offered under the traditional health insurance plan, and the second being the rise in cosmetic and elective benefits, or I should say treatments, compared to the rest of healthcare. So we wanted to marry the two and come up with a plan that covered the white space that traditional insurance didn't. I think a lot of people think that insurance covers a lot more than it really does, and there are a lot of treatments where it might be considered elective, but certain people don't necessarily consider them elective themselves. That's just been the standard or the norm in the health insurance space. So coming up with a new category of benefit and really self-care was the main impetus behind the plan that we created.
And sorry, just to clarify, it was employers that were telling you there was a need for this as opposed to employees?
So it was a combination of both. It was employees, employers, and insurance brokers, actually. So we first went to insurance brokers because we had relationships given the dental insurance space. And the insurance brokers agreed that there were a couple specialties that often they would get asked about. The top two originally that we got asked about, or they got asked about, that weren't covered were fertility and bariatric.
Right.
And then we started diving a little bit deeper and spoke with various HRs as well. And then there were really a whole host of treatments that they thought could be a real benefit for their employees, that their employees are getting on a daily basis, or monthly basis at least, and are paying completely 100% out of pocket for. So we basically ran a lot of different surveys and market analysis, and started growing our product, which was a discount plan for many different specialties that weren't covered, based on the feedback that we got from those three audiences.
Great. So maybe you could tell me a bit more about how you developed the product. Like, is it a technology-based product? Like, how long did it take you to get it in market? Did you have to impact any or change any legislation? Or did you have to get brokers to identify that it needed to be covered? Like, how's it come to market and where does it currently sit?
Yeah, so we started the company in 2020, later in
Great
2020.
timing.
Yeah, yeah, exactly. And actually, the first, year, the largest emphasis was devoted on building our network of providers. So, there wasn't much selling really in the first year because we had to build a network, which is essentially our product. We created a couple what we were calling micro networks, basically cities
Mhm.
in Florida and New York, and contracted with various doctors and was seeing based on their patient acquisition cost what would make sense for them and what would also be a big enough value to our members. And the sweet spot ended up being about 20%. So that's what the typical discount is. We actually got licensed, and it's really on a state by state basis with discount plans, but we're licensed as a discount plan organization in a few of our states right now. And some states you have to be licensed, some states you don't. But we have to follow those guidelines pretty
So the licensing
carefully.
is allocated by state, not by
Yeah.
country. And does it ever go down to a city level? Or
No, it's just on the state level. So, like for instance, Florida, you need to be licensed as a discount plan organization and have a lot of strict requirements. It just so happens that in New York, there aren't as strict of requirements, but it's really state by state. We are up to 5 different states now, but also building out a national network. And the national network is really a mix of um, in-person offices, but also a really good base of telehealth partners as well.
right. So samples of surgery, elective surgery, things that you typically wouldn't find on a benefit plan. I know you said you had 26 of them. Can you just
16.
try 60 of them? Okay. Can
Sorry,
you rhyme off-
16.
Oh, 16. Okay. So can you rhyme off them? I'm sure you
Yeah, so
can.
I typically like to bucket them into 2 different categories just to make it a little bit easier.
Okay.
Specialties that are typically excluded, and then the specialties that are typically capped or limited, meaning that there might
Okay.
be a certain number of visits per calendar year, and employees are oftentimes going over that allotted amount, or it might be harder to get qualified, or various limits. So in terms of the excluded, a lot of the cosmetic specialties included are med spa treatments, which is
Mm,
cosmetic dermatology, plastic surgery, um, hair restoration, weight loss, which is not necessarily, just cosmetic, but can be bucketed into the excluded category.
okay.
Fertility is often excluded, IVF treatments,
Mm,
etc. Bariatric surgery is often excluded, or you have to meet very rigorous requirements in order to get it accepted by insurance. There is also LASIK vision included. Um, there are hearing aids sometimes are excluded. And then on the capped or limited side, physical therapy, chiropractic, acupuncture,
okay.
mental wellness sometimes as well. So I might be missing one or two, but that's the bulk
Pretty
of
good. So let's just run a playbook. So what happens if an employer subscribed to this plan on behalf of their employees and they want LASIK surgery?
Yeah. Yeah. So basically, the employer would offer Beyond Med either as a voluntary or employer paid structure. So Beyond Med is really nice because the employer doesn't necessarily have to pay anything if they don't want to. They can offer it, and then the employees can elect in if they choose to. Our standard voluntary rates are $11.99 per the individual plan per month, and then double that, $23.99, basically double, for the family plan on a monthly basis. And the really nice thing is that that allows them access to our entire network of providers, and they can use the 20% off as much as they would like to. It's a consistent discount.
So I would think something like LASIK surgery they would get back their $144 using one benefit a year.
Yeah, and what we typically see is our members save the entire year's worth in the first month or two, and they're saving thousands of dollars per year and only paying $12 per month. One of the other specialties that I just realized I missed was the anti-aging and wellness, which has become very popular as well, which is IV therapy, hormone replacement, peptide therapy, and a lot of those treatments too.
Right. And a lot of these have a significant benefit for the employer, right? If they're getting healthier employees, happier employees that are getting this benefit that they may not get at another job. So helping them with retention of key talent, and people knowing that they have all this coverage that can be very stressful. Like IVF can be extremely expensive and stressful. Knowing that your employer is thinking about that it can just put you at peace of mind. Right?
Yeah, totally agree. And that's, part of the reason that we created the program too, the employee frustration part. On the flip side or positive side of that, what we're trying to do right now is put together a couple case studies showing an increase of employee retention and morale, in the workplace as well. And I really also think that that's why we're seeing a larger increase of employer paid. Employers realize that there are other ways to make their employees happy other than just increasing their salary. And benefits pay a really big play a really big part in that role. And also, just showing that they really care about their
They're
employees.
investing
They're
in the
listening to
employee.
their employees. Exactly.
Yeah. So tell me about the journey. So when you started in 2020, when did the product launch? How is adoption going to the employers? And then from an employer perspective, how's the adoption going, getting all of their employees onto the platform?
Yeah. So we ended up getting licensed, like I said, in the beginning of 2021. I think what we didn't realize up front is that it would take a little bit of time to get some adoption. The first 6 months that we were trying to talk to brokers and HR, it was a little bit slow. And then after that, by the end of 2021, it really started to pick up. And it's really been, it was a pretty gradual increase up until the last, say, year and a half, where we started growing a little more exponentially. A lot of that, I think, is broker adoption, certainly. You know, when you're working with an insurance broker, rightfully so, they're not going to just, offer something to their whole book of business, on their first go around. They want to see it work really well. And then after that, they'll use it for more of their clients. So the broker adoption took a little bit of time. Also, just understanding like the right messaging for us when we're speaking to HR and how to get in front of more HR, because we always had a very high win rate when we're giving a demo to an HR, because it's kind of a no-brainer.
Yeah.
Make their employees happier by offering something that they don't have to pay for, and show that they're really listening to their employees. But we've gotten a lot better at marketing as well to HR, and our messaging has also gotten better. So really, the last year and a half, we've grown tremendously, tripled in size from a membership and revenue perspective.
That's awesome. So because you're not global or even across the US, are you focused mostly on a smaller client base? Somebody with mostly employees in one state?
So we were initially, but now we have about half of the specialties. We have partnerships that are nationwide. So
Okay.
we can attract a larger demographic. So where it was originally the 4 or 5 states, now we're able to handle employees that are in most different states. So like in the 6 or 7 specialties that we have nationwide coverage for, a lot of them are the very popular specialties. One of them, for instance, is weight loss. GLP-1s have become a very big thing in the health industry and insurance industry. So being able to help people out with that across the country, and just allowing them to save and access the treatments that they really want to, that's been a huge help for them too.
Great. So what's on the roadmap for product improvement?
Yeah, we're constantly trying to, be at the front of innovation in the health and wellness industry. So there are a couple specialties that we're kind of vetting right now, and typically what that consists of is going to our broker and HR partners, asking them, what they've been hearing their employees are interested in. Also looking at, which treatments are rising in popularity, and then conducting surveys ourselves too. So
You're
potentially,
not giving me hints. You're just saying you're looking at them.
yeah, potentially a couple new products, or I should say specialties. But right now, what we have really launched and been successful with in is the GLP-1s in the last 6 to 12 months. That's something that has really grown very fast, and a lot of people are looking for solutions so that they don't have to pay $1,000 per month for these drugs.
That's crazy. That's how much they are.
They can be.
Yeah, yeah. Well, to me that even well, 20% off 1,000 is definitely a good savings, but
It's actually so like I would say 95% of our network is 20% off. Some
Mhm.
of it's a little bit more. We do have a couple that are less. Usually if it's less, it's for a bigger ticket item where the member's saving thousands of dollars. The GLP-1s happen to be a lot more than 20% savings. We're seeing like 60 to 70% savings.
Wow.
Yeah.
Wow. That's awesome. How do you help employers drive adoption?
So, what we've been doing that's been really helpful, not just for Beyond Med, but also for the employers, is well, first of all, we like to get in front of the employees if we can, and be the ones educating. Understand that we don't always get that opportunity, so we create videos. We actually have like a commercial coming up on the way too, um, and try to create really good marketing material. But when we are allowed, we like to come and do either virtual overviews or come and help out with open enrollment. But the thing that's been really helping HR out is attending all of their health fairs, and actually will bring providers to their health fairs to perform
Mm,
many treatments. Like,
mhm.
for example, acupuncture ear seeding has been a really popular one, or we'll bring a massage therapist there to give many treatments, so that it not only drives employees for Beyond Med, but also to the actual health fairs, and increases participation, not just for our benefit, but for all benefits.
Good. So 4 years into this, what would be your words of wisdom for other entrepreneurs trying to sell to HR professionals?
That sometimes, although it's only been 4 years, it seems like longer. Sometimes it takes a couple iterations of understanding what the proper messaging is, and to really, really listen to your customers. Um, you are never right, your customer's right. So helping, using their opinion to help form your product has really helped us, and just being flexible, and being able to meet the demands of your customers too. We want what our customers want, is essentially.
Great. Um, I hope our readers and listeners found this very interesting. The best way for people to contact you.
Yeah, so our website is www.beyondmedplans.com. So feel free to go there, or my personal email, if you want to email me, is Brent, Brent, at beyondmedplans.com. That's by email, and we will get back to you very, very quickly.
Sounds great. Thank you.
Thank you for joining us on Human Experience Inspiring Workplaces podcast by HR.com. We hope today's episode gave you fresh ideas to enhance your workplace environment. For more insights and resources, visit HR.com/podcast or tune into wherever you listen to podcasts. Until next time, keep creating spaces where people and performance thrive.